This past month, I have had the pleasure of exploring this incredible hospital with incredible people. I've seen things that I never dreamt I would see, from a surgery on a completely broken bone to a birth, to simply being in a room with a patient when they were examined. I had the privilege of being trusted to be strong enough to experience this hospital setting. I know that for everyone in this program, this past month will stay forever in our minds as the month when everything changed. We have fallen in love with the healthcare field and all the emotions, people, and most importantly, the joy of helping someone return to their best quality of life.
And this is really all about the future, about their future, but also about the future of all of us in the room. Because as we age, as we start families, as our parents who might be here grow older, as our siblings grow older along with us, we will need this hospital more and more. And these are the people who are going to be caring for our loved ones.
Over the course of the next 4 weeks, we've all really learned quite a lot in a lot of different sort of areas of thinking, not only medical terms and about different diseases and treatments and procedures, but we've also learned a lot of tangible skills. We got our CPI blue cards and we got our basic life support certification. We learned how to wash our hands properly. And we've met so many physicians and nurses and techs and administrators who have incredibly and inspirationally really taken the time to talk to us. They didn't just tell us to sit there and observe. We were encouraged to ask questions, and we did.
We have just experienced a car pileup on the I-25. There are 9 patients severely injured, and we have to diagnose them with infield trauma and place them according to how severe their injuries are.
First responders will use a triage system to decide which patients to transport to a hospital and treat first.
This patient is suffering from a possible concussion and she's missing the tip of one finger. Any patient that is in need of immediate attention to survive would be given a red card.
This patient has gone into cardiac arrest and a bystander notified us that it was roughly 2 minutes ago, which places her still within the window of time that she could benefit from CPR. So in the field we would administer CPR and use an AED to give her electric shocks until she was revived, in which case she would be given a red card because she needs immediate treatment.
We just did a ratio of 30 chest compressions to 2 breaths, and this is important when doing CPR because you have to give effective chest compressions to get the blood circulating and the breath so they can get oxygen to the brain.
So after having a stroke, the best thing you can do is therapy. There are 3 types of therapy: physical therapy, occupational therapy, and speech therapy.
Technology has been advancing quite rapidly, and doctors have been able to keep up quite well with looking at how you can diagnose something like a broken arm without having to do a physical examination, or how you can diagnose bone cancer.
I did diseases of the respiratory system. I made a video above. My first disease I researched was mesothelioma, which is a type of lung cancer caused mostly by asbestos.
Esophageal varices are caused by liver cirrhosis, which is liver failure. When this happens, blood gets backed up into the veins in your esophagus and occasionally your stomach. This causes hypertension. Symptoms aren't relevant unless one of the veins breaks.
This is a sheep brain. It closely resembles a human brain. Here is the frontal lobe.
The front of the brain behind the forehead, and it's in charge of a lot of things because it's the biggest lobe, and it's in charge of things like motor function, emotional, and personality.
The best way to prevent a stroke is being healthy. You need to exercise, maintain a healthy diet.
I would like to thank the foundation, and in particular Mr. Robert Glick, for giving all 22 of us this incredible opportunity. It was certainly worth it to wake up early during summer vacation. I'm counting the days until next year. Thank you.